Spreading. Health officials in Washington state say the second person has died, and the number of confirmed cases in King County now has risen to 10. Governor Jay Inslee has declared a state of emergency in response. Over in Florida, Governor Ron DeSantis has declared a public health emergency after 2 people tested presumptively positive for the virus, meaning they have been tested positive by a public health laboratory, but the results are pending confirmation by the CDC. And here in New York, Governor Andrew Cuomo has confirmed the first case of coronavirus in New York City. The woman in her late 30s contracted the virus while traveling abroad to Iran. In response to the global increase in confirmed cases, the Trump administration announced on Saturday that it would extend an existing travel ban on Iran. It will apply to any foreign nationals who have been to that country over the past 14 days. The State Department is also increasing its warning, advising Americans not to travel to Italy and South Korea. All
right, joining us now, infectious disease doctor and a senior scholar at the Johns Hopkins Center for Health Security, Dr. Amesh Adalja. Doctor, thanks so much for joining us on this. We have some new confirmed cases in the U.S. jumping just this weekend from 65 to 88 as of last night, the last case being confirmed right here in New York City. Do you believe health officials around the country right now are prepared for what is to come?
I do think that we've been saying, like we've been saying from the beginning, this isn't a containable virus, and we can expect to see cases all over the United States and more community-based spread. There is variable degrees of preparedness, and what I'm most worried about is whether our hospital systems are prepared, because most of these cases are going to be mild, but they're going to end up in emergency departments, and some of those patients are going to end up in ICUs, and we often operate near total capacity. So we really need to make sure that hospitals are ready to deal with this surge of patients, and that we have our diagnostic testing up to par, because we've had some trouble being able to get tests out to people. We need to be able to test widely to understand what's going on in our communities with this virus.
Doctor, let me pick up on that point. Testing widely, because this is the concern a lot of people have right now. The Washington Post is reporting on a new study. Researchers say the virus may have been spreading undetected in Washington state for the past 6 weeks, possibly infecting scores of people. How likely is it that this virus is perhaps spreading in other states, in other parts of this country, undetected?
That's completely the case. It's extremely likely that that's going on. Remember, this virus appeared in China at least in November. There were no restrictions going on in November. And it's a respiratory virus that has mild illness in most patients that spreads efficiently from human to human. It likely seeded the world before we even knew about it and was mixed into our cold and flu season. And we really didn't know anything about it until we actually started testing. So I do suspect in every place in the United States there is some community spread going on, because that's just what we know about respiratory viruses. And the testing really is going to underestimate the number of cases that we have. And I think it's really important to get a handle on that so people aren't panicked, that they know that this is out there and it's already been out there, and it's not some failure of a travel ban, which really isn't expected to make a big dent in the number of cases.
So let's go with that for a moment, because there is this debate over a medieval approach to containing this disease versus a kind of more new age approach. And the medieval approach being closing off borders, cordoning off towns, some of which China has implemented. And some experts say that is what has contained the disease and given the U.S. about a month-and-a-half jump on this whole thing. What do you think is the best approach going forward?
Right now, we have to move from this idea that this virus can be contained to one of mitigation, preparing our healthcare systems, increasing diagnostic testing, increasing vaccine development, antiviral clinical trials, public health communication. That's where the scarce public health resources need to be focused, not on travel bans, not on quarantine, really just moving away from containment, because this is something that's going to be like 2009 H1N1, which is going to spread, and we need to get ready now while we have the opportunity.
So, Doctor, if you are saying the closure of borders may not help, or containment, and we need to shift away from containment, is there any point in shutting down schools, in canceling large gatherings like tech companies have canceled some of their big conferences, and all these types of events that we're seeing around the world that are essentially being canceled? Like even in Saudi Arabia, the pilgrimage, I believe, the annual pilgrimage is being reduced and prevented from having a lot of
stopping
worship.
Flights into the country as the federal government already has.
Is there any reason to do these things?
So there's not a one-size-fits-all to mass gatherings. It all depends on what's going on in your community. And if you have a big political rally or something going on in your community where people are going to be mixing, it can decrease the, kind of blunt the impact, and it can kind of flatten the curve, the epidemic curve of how many cases you get. And that may be necessary in certain communities, but you have to look at those as one by one and see if that's actually going to help with mass gatherings. And that's a little bit different than closing borders and doing things like that. And I think that we have to think about, in schools is a different thing, because you have to think about, are kids spreading this virus? And we know that's true for influenza, but we don't know that that's true for coronavirus. And you have to think about, where are those kids going to go if they're not in school? Are they going to go to the mall? How are they going to get childcare for those kids? All of those types of cascading impacts happen when you close a school, so it's not an easy decision to make.
It seems like that's one of the biggest outliers with coronavirus, is we still don't know so much about this disease and how it's spread and who exactly is vulnerable.
Yeah.
Dr. Amesh Adalja, thank you so much.
Dose of reality there. Thank you,
expert
Doctor.
opinion on
Always
this.
appreciate your insights. Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.